Hi, I'm Dr. Sai Vivek Areti. These past few weeks have been really devastating for whole of India. Everyone is doing whatever they can to bring life back to normalcy in this war against COVID-19. Not knowing how the virus really affects us and what measures are required to control it is causing unnecessary panic in general public. This is leading to cases becoming severe and ultimately death. Lives can be saved if proper steps are followed from the beginning. First and foremost, these are the facts you need to know. I've been seeing a lot of posts recently about this, and I feel this needs to be addressed. Antibiotics don't work on a virus. When you get affected by coronavirus, you start having symptoms of fever, dry cough, loss of taste and smell, sore throat, extreme weakness, body pains, etc., which are more common symptoms, and diarrhea, which is less common. The fact that people are being given ivermectin, which happens to be an antiparasitic, not even an antibiotic, as a treatment protocol along with doxycycline and other antibiotic drugs is something everyone needs to worry about. The in vitro studies suggest that ivermectin acts by inhibiting the transport protein, which the virus hijacks for enhancing the infection in the body. Apart from this in vitro activity, no clinical trials have reported the clinical benefit for ivermectin in COVID patients. However, studies suggest that achieving plasma concentration necessary for antiviral effect would require an administration of doses which are up to 100 times higher than what we are giving right now. FDA issued a warning in the US that ivermectin intended for use in animals should not be used to treat COVID-19 in humans. In simple language, viruses are extremely small when compared to bacteria. They enter the cell, infect the cell, and then replicate. Bacteria being larger cannot do that. So when an antibiotic is given for a viral infection, it obviously cannot penetrate the cell covering and in turn acts by killing the whole cell along with other healthy cells around it. So when you're taking an antibiotic for viral infection, you're also losing your immunity, which is the reason many people complain of feeling unhealthy and weak after taking an antibiotic course. Taking an antibiotic course for a secondary infection which might occur in later stages of COVID-19 would actually make more sense. 2. Steroids, blood thinners, remdesivir and oxygen. The present scenario in India, as we are seeing on a daily basis, is unnecessary stocking up of drugs like remdesivir. It has reached a level where drugs like these are being sold on black market. This drug has not proven to work in COVID-19 infection and WHO recommends against its use. I have been seeing patients with mild or even no symptoms panicking and stocking up these unnecessary drugs at home, buying or renting oxygen cylinders when the situation is not bad. It's sad to see many asymptomatic patients getting treated with high-powered steroids and blood thinners because of a simple reason that they are COVID positive. These are the drugs which are used to treat critically ill patients. Number 3, vaccination. There are presently 2 vaccines which are being widely used in India to vaccinate people. As I speak, other foreign produced COVID-19 vaccines that have been granted emergency use authorization in other countries are being fast-tracked for approval in India. There are many strains of coronavirus that a single vaccine does not cover all the strains. Vaccines are safe and effective only after taking the complete set, that is 2 shots. That being said, it doesn't mean that you're completely immune to the virus. People are not really understanding how a vaccine works when the situation here is this bad. They aren't following the regular basic safety protocols like wearing a mask, thinking that vaccine will protect them in spite of repeatedly telling that vaccine is not a cure. So here are certain precautions you shouldn't forget even after getting vaccinated, which is wearing a mask. Double masking has been found to be very effective to control the spread. Number 2, social distancing. Number 3, washing your hands. I can't stress enough about this. Tests and admissions. There are many tests which are being advised for patients with COVID-19 like D-dimer, C-reactive protein, lactate dehydrogenase, interleukin 6, CT scan. Remember that these blood tests are not specific for COVID-19 and will be abnormal in any infection and inflammation. CT scan of the chest has been made a common routine investigation without actually thinking about how intense the exposure is. The tests will obviously be abnormal as you have an ongoing infection in your body. Here's what you can do if you're COVID positive. The most important thing that you need to do right from the beginning is to not panic. This will create unnecessary thoughts and cause more harm than good. Isolate yourself as you would not want your family members or others to contract it. And in most of the cases, the patients are asymptomatic or the symptoms are mild, and by taking multivitamins and simple home remedies, they will become normal. In cases where the symptoms include high-grade fever with cough or sore throat, taking paracetamol thrice a day along with multivitamins and alternative medicines like homeopathy have been found to be very effective in controlling the symptoms and bringing the person back to normal in 10 days. Stop self-medicating and stop listening to what your friends or relatives tell you, because that again leads to panic. Speak to a doctor and take the treatment accordingly based on your symptoms. Do yourself a favor and get home a pulse oximeter, which is used to check the oxygen levels. Make sure that you check not more than thrice a day and ensure that it is more than 92%. Again, remember, if the oxygen levels are dropping below 92 or if you feel breathless, before panicking and contacting your doctor, there is a method called as prone breathing, where you lie face down on your chest and abdomen and perform deep breathing for 15 to 20 minutes. This should be performed thrice a day. Doing this has been proven to be very effective in getting your oxygen levels back to normal. Here's what you need to eat when you have COVID. The most important aspect of the treatment is taking a nutritious diet, which includes eating a lot of green leafy vegetables, a lot of vegetables to be precise, and also fruits. Having dry fruits daily, drinking juices and coconut water will help a lot in alleviating the symptoms and reducing the weakness and help in hastening the process of recovery. Remember, hydrating yourself is the best way to get rid of your symptoms. Please do not panic and unnecessarily get hospitalized. Leave the beds to those who actually require it. Sitting in one corner of my clinic, I can reach only a few people. But if I can spread this information to at least 0.1% of the population, I feel that it would make a difference. Thank you.